Okay, so if you have acid reflux and you have a lot of the questions as to what it is, why it's happening, and what are the things that you can do to prevent this from happening, then this video is for you. So without wasting any more time, let's get right into the video. So what exactly is acid reflux? Now, if you look at the model of your stomach here, you have this acid in your stomach called hydrochloric acid. And this acid is something that helps you with digestion, keeping the bad bacteria away, and it also helps with the absorption of certain types of nutrients. And it's safe as long as it stays inside of your stomach. But if for whatever reason it chooses to move up into your esophagus, that's when it becomes the problem. And that's essentially what's referred to as acid reflux. And there are certain types of complications that it can present with. So number one will be inflammation of your esophagus, esophagitis, and this is when people feel the sensation of heartburn. And number two is strictures. So if you continue to inflame the esophageal tissue over a long period of time, you can also start to form this scar tissue, which basically narrows the lumen of your esophagus or your food pipe, making it really hard for you to be able to swallow the food. And this is what people feel the difficulty of swallowing. And number three is GI bleeding or upper GI bleeds. So you have a lot of these blood vessels that supply the blood to the esophageal tissue on the inside. So if you damage those blood vessels with the hydrochloric acid because of the reflux, you can end up having an internal bleed, also referred to as upper GI bleed. And it can present with you vomiting out the blood, also known as hematemesis, or the blood in your stool, also known as melena. And if this continues to happen over a long period of time and you're not seeking any medical attention or continuously putting in the effort to manage the symptoms, this can damage the esophageal tissue to the point where the tissue cells will have to go through a structural and functional change and will put you at a higher risk of developing esophageal cancer, unfortunately. Okay, so now that we understand what acid reflux is, let's quickly go over the different causes of the disease process. Okay, so the number one most common cause is the decreased lower esophageal sphincter tone. Now the question becomes, what exactly is lower esophageal sphincter? So it's a muscle that separates your stomach from your esophagus and it holds a certain tone to it. And it opens up every time you eat the food, it opens up and lets the food in and closes back up to prevent the food going back up into the esophagus from your stomach. But in some cases with the growing age, people start to lose the elasticity and the tone of this muscle, which allows for the hydrochloric acid to move back up into the esophagus and give them the symptoms of acid reflux. And besides the age, there are some known culprits that can also decrease its tone, which are caffeine, smoking, and alcohol. And the second most common cause of acid reflux is sliding hiatal hernia. So you have this muscle called diaphragm and the stomach usually sits below this muscle. But if this muscle gets weaker or you go through a trauma, the stomach can actually slide up above this muscle. And with that, the lower esophageal sphincter can lose its tone or its functionality and allow for hydrochloric acid to move up into the esophagus, lead to acid reflux symptoms. And number three is very simple. It's just the overproduction of stomach acid. Now, if you have tons of hydrochloric acid in your stomach, chances are it's going to want to come back up into your esophagus and give you the symptoms of reflux. And it's been linked to three different culprits. First one is NSAIDs or non-steroidal anti-inflammatory drugs. Number two is alcohol and smoking. And outside of all three of these culprits, some people can unfortunately develop these tumors called gastrinomas. They're very, very rare, but they can gain the ability to release lots of gastrin. It's a hormone that's directly responsible to stimulate your stomach to make hydrochloric acid. So if you have tons of gastrin, your stomach will start to release lots of hydrochloric acid as a result. And what do you think is going to happen when you have tons of acid in your stomach? It will flow back up into the esophagus and give you the symptoms of acid reflux. Okay, so number four and the last cause of acid reflux. If you take a look at these two lines, think of this as your abdominal cavity. And if you were to press against this abdominal cavity, what do you think is going to happen? You're going to press against your internal organs, including your intestines and your stomach. And as a result, the food contents will start to push back up towards your esophagus and lead to acid reflux symptoms. Now, I like to divide this in two different categories. Number one is population specific, and number two is lifestyle. So in population specific, the number one cause is pregnancy. So in pregnant women, because of the development of the fetus, they have lots of intra-abdominal pressure, which leads to the symptoms of hydrochloric acid. And number 2 is gastroparesis. Now, this is a disease associated with diabetes. What happens is people with diabetes, they start to damage their nerves. So in this case, you have this nerve called the vagus nerve that supplies your stomach for it to be able to contract and move the food contents along your GI tract. But what if you damage this nerve? So if you damage this nerve, are you going to be able to send the signals to your stomach to move the food contents down your GI tract? No. And the food contents will start to build up in your stomach, and delayed gastric emptying will cause the food contents to push back into your esophagus and lead to acid reflux symptoms. And number 3 is IBS, or irritable bowel syndrome. Particularly people with constipation, they get bloated and they increase the intra-abdominal pressure and again lead to the same problem of acid reflux. And the other category is lifestyle. So people with obesity, now we're not talking about high BMI, we're talking about the central obesity, or if you have lots of fat wrapped around your internal organ, that can also create higher intra-abdominal pressure, which can result into acid reflux. And number 2 is heavy meals or large meals. Now, if you're eating lots of food all at once, this can definitely increase the intragastric pressure and make you feel nauseous, or can even make you feel like throwing up, which can obviously give you the symptoms of acid reflux. Okay, so now that we've covered all the different causes of acid reflux, let's quickly take a look at the things that you can do to try and prevent this from happening. So first things first, if you have acute onset of heartburn or chest pain-like symptoms, you want to make sure that you seek medical attention, because these symptoms can also be related to different types of cardiovascular diseases. So you want to make sure that you're safe. And once you get the diagnosis from your doctor that it's GERD or acid reflux, you can start to do a few things at home to try and alleviate some of the symptoms. So the first thing you can try to do is limit the amount of caffeine intake, try to quit smoking, and limit the amount of alcohol intake, which will allow you to recover your lower esophageal sphincter tone and try to help you alleviate some of the symptoms of acid reflux. And number 3 on the list is, unless you absolutely have to or prescribed by your doctor, try to limit the intake of non-steroidal anti-inflammatory drugs and alcohol, which will help you tamper down some of the hydrochloric acid production and obviously help with your symptoms. And number 4 is try to lose some body weight and also eat smaller meals, which will directly reduce the intra-abdominal pressure off of your abdominal cavity and eventually help you alleviate some of the symptoms of acid reflux. And number 5 is my personal favorite, which is to keep a food journal. What this is going to do is allow you to keep a track of different types of foods that you're eating every single day, because a lot of the times people find certain types of foods that become the trigger of their acid reflux. So if you have a track of all those foods, you can actually try to eliminate those foods to alleviate your symptoms. And some of the examples of those foods are, some people don't do well with whey protein or dairy or even citric foods. Okay, so I know this is a lot of information, but I really hope that you have a clear understanding of GERD or acid reflux and its causes and the things that you can do to try and prevent this from happening. Also, we're gonna make the next video on the diagnostics and the treatment plans that are available for acid reflux, so you could be at the same page with your doctor and be able to ask the right questions to get the best outcomes out of your treatment. And if you find this video helpful, please support us by subscribing to the channel, like the video, and also send this video to someone who you might think will benefit out of this information. And I would really appreciate the support, and I'll see you next time.